Hi, welcome to Mental Health Monologues. My name is Natalia. I'm a licensed clinical social worker in the Orange County area of California. It is my hope that through this channel, you can get some information and education about the social work and mental health fields. With that being said, this channel is not meant to be or replace therapeutic advice. So if anything I discuss in this channel or in this video piques your interest, applies to you, please go ahead and take that information back to whatever mental health professional you are working with so that you can further discuss how it applies to you. So May is Mental Health Awareness Month, so what better time to discuss diagnosing and understanding that process? And so that's what we're going to be doing here today. Let's go ahead and dive in. So before we take a deep dive into diagnosing, what I really want to do is make sure that you have a basic understanding of diagnosing. So what I like to do is talk about an analogy that I use in session, but I also want to take some time to look into the Diagnostic and Statistical Manual of Mental Disorders, better known as the DSM. Okay, so first, my analogy that I use in session. I am not a medical professional, but what I do encourage my clients to think about is kind of when you go to a doctor, you go to the doctor because of a set of symptoms that are impacting your life. When you go to the doctor will listen to those set of symptoms and they will give you a diagnosis based on your symptoms. It is the same thing for mental health disorders. You have a set of symptoms, and that set of symptoms is correlated to a diagnosis, just like a set of symptoms would be correlated to a medical diagnosis. Mental health diagnoses are here, and this is where all the criteria live and all of that diagnoses that you can receive for a mental health disorder based on mental health symptoms. So let's take a deeper dive into this book so that you can have a better understanding of what that looks like. All right, so this is the Diagnostic and Statistical Manual of Mental Disorders. It is published by the American Psychiatric Association, and it is the 5th edition of the manual. There have been other editions that include different diagnoses, different considerations, and so as the field evolves, so does this manual. So let's go ahead and dive in. First thing I want to point out is that there are a lot of different categories when it comes to mental health diagnosing. Most people are not aware of the categories and also are not aware of how many different types there are. And so when we're looking at different mental health diagnoses categories, it houses our disorders. So here is neurodevelopmental disorders, and it houses the intellectual disabilities, communication disorders, autism spectrum disorder, ADHD, specific learning disorder, motor disorders, etc. And each category, as you can see, has different diagnoses. What I do want to point out as I kind of flip here is that there is a very big difference between layman's use of these terms and the actual clinical term. So let me give you an example. I hear a lot of people say, oh my gosh, I'm so depressed. And usually what that person is trying to say is maybe I'm sad, maybe I'm having a hard time, things of that nature. And that's completely valid. However, there is a very big difference between sadness and clinical depression. Or I've heard people say, wow, that person is so antisocial. And what is actually being meant by that is that someone is not maybe socializing to the degree that that person thinks they should, or they're just someone who's quiet and keeps to themselves. And that is a very different description than what is actual clinical antisocial personality disorder. And so I just want to throw that out there just to be aware that someone using a clinical term to describe a situation or behavior does not necessarily mean that it is the clinical definition of that term. So what I wanted to show you here, and what I'm going to flip to, is a section of these categories just for us to explore a little bit. This is the Depressive Disorders category, and I just chose it since most people are pretty aware of depressive disorders. And all of our categories are going to start with an introduction into that disorder category, and then it'll move into the different diagnoses with their criteria. I'm actually going to flip over to major depressive disorder just because, again, it is a diagnosis that most people are aware of. And as you can see here, major depressive disorder has 5 different criteria. We have criteria A, B, C, D, and E. And when I'm diagnosing, I go through and I look at these criteria based on what is being reported to me by the person I'm working with. And I'm going to say, okay, well, these symptoms seem to be aligned with such and such disorder, in this case, major depressive disorder. And I'm going to go to this criteria and I'm going to make sure that the symptoms that are and behaviors that are being reported to me do in fact align with this disorder. Now, the caveat to that, and in my training, the way that I diagnose is that I rule out instead of rule in. And what that means is that my purpose in diagnosing is not to put someone into these categories. I am not looking for behavior and symptoms that will justify this diagnosis. I am looking at these criteria, and I'm seeing if the symptoms and behaviors fit, and if they don't, then I'm going to look for something else. But I'm not trying to shove someone into this category. As we move through this diagnosis, something to take into consideration or know is that there are several diagnoses that have other features, what are called features, within the diagnosis. And this is one of the reasons, among many, as to why it's so important to make sure that you are working with a mental health professional when it comes to diagnosing. Diagnosing is difficult, and there are a lot of considerations. And this is an example as to why. Because when we're talking about major depressive disorder, you can see here that it can have a lot of different features that you may not think are associated to this diagnosis, but are in fact part of this diagnosis. So, one of the many reasons to work with a mental health professional. All of the diagnoses have this section afterwards that explains in more detail things to take into consideration and think about when you are looking at this diagnosis. More information that for clinical consideration. One of the things that I do want to point out is this category right here, differential diagnosis, that is included with all of our disorders. And this is a second reason why you need to be working with a mental health professional when it comes to a diagnosis, because there are symptoms and behaviors that overlap amongst different diagnoses. And so as a professional, I'm going to be looking to make sure that the symptoms and behaviors I am looking at are not better characterized by one of these disorders. Again, I'm not trying to shove the person that I'm working with into a category. I am trying to see what is the best diagnosis that defines or characterizes what they are going through. The last thing I want to point out is comorbidity. Another reason to be working with a mental health professional is that this comorbidity is one of the clinical considerations when it comes to diagnosing. And basically what comorbidity means, is that different diagnoses have other symptoms, behaviors, issues, challenges, barriers, whatever, that are closely related to it. And so as the therapist, I'm going to be looking at these and making sure that if it's appropriate, I am including it in my treatment plan and having an active conversation about these things with the person I am working with. And as you can see, then it continues into the next disorder. The last thing I kind of want to share as an overview of the DSM is this section at the back called for other considerations that may be a focus of clinical attention. Most people in the mental health field will call it V codes because it starts with a V. And I share this because this is actually something that when I diagnose, I often use to show a full picture of what it is that someone is dealing with, to kind of give a better
visual of the story, if you will. I have found that most times a single diagnosis or just having the diagnosis doesn't accurately reflect the challenges and barriers that the people I am working with face. And so I include these to really, I guess, humanize, if you will, for the lack of a better term, uh, the people I am working with. And so there are a lot of V codes to show the challenges and barriers people experience. So with that being said, that is an overview of the DSM. You can access this online. You can see it's quite thick, and so most clinicians will have a smaller version. I have the desk version or the desk reference that doesn't have all of the additional information. It just has the diagnosis and criteria. But that is our quick little overview of the DSM.
Now that you've gotten a chance to look at the DSM, let's talk about some additional considerations when it comes to diagnosing. Diagnosing is an objective and subjective process. It is objective because, as you saw, there is a set of criteria that you will have in order to get a mental health diagnosis. But it is also subjective because, depending on the professional who is diagnosing you, there might be different interpretations or views of a diagnosis. As I've mentioned in my previous video, there are a lot of different professionals that can diagnose and do therapy. And so by extension, that means that there's a lot of different views on how to diagnose, what it looks like. So for example, you can be diagnosed by a psychiatrist or a doctor. You can be diagnosed by a psychologist. You can be diagnosed by different mental health professionals who are licensed or on the road to being licensed, like licensed clinical social worker, licensed marriage family therapist, there's professional counselors, so on and so forth. There's a lot of varying professionals. And so amongst all these professionals, you have different experiences, different training, different theoretical backgrounds, different views of diagnosing. And all of this is what creates an objective and subjective process. And this is why you may go from one mental health professional to another, or a doctor to a therapist, a different therapist, and you may receive different diagnoses because views of diagnosing differ amongst different professionals. So that is something to keep in mind when you are possibly seeking a diagnosis or you are being diagnosed by a mental health professional. So another consideration when we're talking about diagnosing is that diagnosing is difficult and it does require training. And the reason I say that is that if you've ever taken a psychology course, you likely walked out of there with at least 5 different diagnoses. I know that when I took my first psychology class and I learned about mental health disorders, I walked out of there with at least 5 diagnoses, which were all incorrect and not accurate, but we all do it. We start diagnosing our friends and our family and ourselves, and there's all this information, and we just start looking and applying those labels to people. When we talk about diagnosing, there's a lot of intricacies and a lot of considerations when it comes to diagnosing. So if you do have symptoms or you've done research that leads you to believe that you have a certain diagnosis or would like more information, please take it to a mental health professional so that you can better understand what that means, if it's an accurate diagnosis, if there's a different diagnosis that would be accurate, because again, going back to what we discussed with the DSM, there are a lot of overlapping symptoms with different diagnoses, and it takes a mental health professional who has been trained to tease apart what is what. And so please take those to a mental health professional. Another consideration when it comes to diagnosing is that depending on where or how you are receiving services, that may impact diagnosing. So let me clarify what that means. Is that, at least in California, I'm sure that similar in other states, but at least in California, there are several ways for you to receive services. For example, you can go through your insurance. You can go through a community agency. You can go through a private practice to seek services. And so depending on where or how you are seeking services, that will impact diagnosing. For example, insurance, and I'm just going to speak into my own experience with people that I have worked with, but typically when it comes to insurance, you will likely be diagnosed if you are going to receive or you are approved to receive services. The logic behind that is going to go back to the analogy that I've been using for mental health services, the analogy of going to the doctors. So the reason that you go to a doctor is because you're not doing well. And a set of symptoms that took you to the doctor's office is going to likely lead to a diagnosis. It is a similar thought process when it comes to mental health symptoms. You are experiencing mental health symptoms, which means that there is a diagnosis and a reason for you to be seeking those services. And so from the insurance point of view, if you're seeking services, it's because you are seeking support for a diagnosis, and a diagnosis needs to be given. Now, if you've had different experience with insurance, please let me know. Leave it in the comments. I'd love to hear about it. But again, that's been my experiences with people that I have worked with and how they have gone through insurance to seek services. When you are working with a community agency that may not necessarily be dealing with insurance, they may or may not put diagnosing as a priority. Same with a private practice. There may or may not be a priority in diagnosing, and so you can receive services with or without a diagnosis. And so if you are receiving or looking to receive mental health services, those may be some considerations for you to take into account when you are seeking services. So now that we've talked a little bit about diagnosing, different considerations, an overview of the DSM, I'd like to switch lenses and talk a little bit about my recommendations for if you are someone who is receiving mental health services, you're looking for mental health services, if you're someone who has or is looking for a mental health diagnosis, I have some recommendations for you. So my first recommendation is going to be know your diagnosis. Now, diagnosing and having a diagnosis is a very personal journey. It can be very scary. There's a lot of different reactions. I've had people that I work with who don't want to know if they have a mental health diagnosis. I've had people who are very curious, and having a mental health diagnosis is a relief because it has a name. The thing that I've been experiencing, it has a name. So everyone's going to have a lot of different experiences or reactions to a diagnosis, and that is valid and that is part of your journey. But the reason that I encourage you to have a diagnosis is so that you can be empowered to help yourself, set yourself up for success. I'm not saying that your journey is going to start off with triumph. It's not going to be easy. That is not what I'm saying. You are going to have a journey to walk when you do learn about a mental health diagnosis and what that means for your life. But much like when you go to a doctor's office, your treatment for the flu is going to be different for a cold, than for ulcers, than for cancer, than for migraines. Medical treatment is not always appropriate for all diagnoses, and that's the same for mental health diagnoses. Not everything is appropriate for your diagnosis or what you're going through. And so knowing about your diagnosis can empower you to seek appropriate medical support or psychological support, therapy, treatment, whatever. It's going to help you be successful in those things. So that is why I encourage that if you have a diagnosis, you know about it and get educated on it. So my second recommendation is to be a good consumer of information. Ask questions, do your own research. When you're doing your own research, please make sure to look at reputable resources. There's a lot of information out there, put out there by people who have their own experiences, which are totally valid for them. But when you're looking at those experiences, also collaborate or look at reputable resources like, for example, the Mayo Clinic. I give that often to people that I work with because I feel that it gives good, concise, straightforward information regarding diagnosis, treatment, and different things like that. You can look at the CDC, who also has information on mental illness and mental health disorders. You can look at NAMI, the National Alliance on Mental Illness. They also have information when it comes to mental health disorders and mental illness. Ask questions. I already encouraged to know your diagnosis, but beyond that, ask the questions. Have a collaborative relationship with your mental health provider. That is something that I encourage within my own sessions because I believe that clients should be aware. Again, I believe that knowing your mental health diagnosis can be empowering depending on how you go about understanding your diagnosis. Your mental health professional should be able to justify the diagnosis. It's not just on a whim, I'm feeling like depression's the diagnosis of the day. No, you should be able to ask your mental health professional, why is it that you came to this conclusion? Can you share with me how I meet criteria? You can ask them, did you consider any other mental health diagnosis before giving me this diagnosis? Ask those questions. Be curious. There's nothing wrong with that. Like I mentioned, I encourage a collaborative relationship when it comes to diagnosing. I have sat with clients, opened the DSM, and used an entire session to better help them understand different diagnoses and where it comes from. And we've narrowed it down to help someone understand this is what you're experiencing. I've had people come back after we've done that, and they're like, I've been thinking about that diagnosis, but there's this one thing that's been bothering me. There's these symptoms that don't quite fit into what we're talking about. What do you think? What about this? And guess what? We've sat down, opened the DSM back up. All right, let's see where those symptoms lie, and let me help you understand maybe how that might fit into a diagnosis. There is nothing wrong with asking questions. There's nothing wrong with having a collaborative relationship with your mental health provider, and I encourage it. So my third recommendation is going to be an active participant in your treatment. You are the one that is walking your journey, and along your journey, you will likely come across many mental health professionals, doctors or psychiatrists, treatment programs, whatever is right for you. You will likely meet a lot of different people along your journey. Being an active participant in your treatment is important to your success, at least from my perspective. Take notes, ask the questions, know your options, know the impact of your decisions. So I'll give an example. I have a lot of people who do not want to take medication, and that is fine. However, depending on your diagnosis, you may be someone who needs medication to help you through different situations, through seasons of life, and things like that. Know the impact of that decision of what will life be like with medication or without. If I decide not to do this treatment, what are the pros and cons of each decision? All decisions have pros and cons. Are you being active in that decision? Are you being active in understanding what are the pros and cons of your decision? Like I said, all choices have pros and cons. It's just, what are you willing to deal with? What are you willing to live with? Be active in those choices. Be honest with your mental health providers. It's not something that I believe I've already mentioned, but a lot of diagnosing, a lot of treatment, a lot of those things is going to be based on your self-report. Unless I've been with you as your therapist for a long period of time, there are going to be things that I don't know unless you tell me. And if you're not telling me, if you're not being honest, if you are forgetting information, withholding information, that may impact your diagnosis, that may impact your treatment, that may impact a lot of different things. So please be honest with your mental health providers. So last and most important, I think, is that your journey with your diagnosis, with your mental health services is your own. There are going to be a lot of people that come into your journey that will give you recommendations, that will give you information, but at the end of the day, you are the person who's going to live the successes and consequences of your journey, no one else. And so I encourage you to own your journey, to be active in your journey, and to make the decisions that are best for you in whatever journey you are going through. All right, so that is it for me today. Thank you so much for joining me. If you enjoyed this video, go ahead and hit the like button. If you would like to learn a little bit more about the mental health and social work fields, go ahead and subscribe. If you have any questions, comments, suggestions for any future videos, go ahead and throw them in the comment section. I would love to hear from you. And with that being said, I hope you have a wonderful day. Live your passions, love your journey, and I will see you next time.